I would like to turn the presentation over to my colleagues, Brittany Hernandez and Mark Fisher. Brittany is MDA's Senior Director of Policy and Advocacy, and Mark Fisher is our Advocacy Engagement Manager here at MDA, and they are going to share some exciting opportunities in grassroots advocacy. So Brittany and Mark, feel free to take it away.
Thanks, Elise. I appreciate that introduction, and thank you to everybody who is joining us. It is really great to have all of you here for this rescheduled event. We are really, really pleased to be able to host you. So I'm going to give a quick run through of MDA's policy priorities generally and how they are, moving and changing to react to everything that's happening here, and then we'll turn it over to Mark shortly. So the way that we organize our approach to public policy and advocacy is kind of split into three different pillars of importance. The first one is access to care and therapies from day one, and this really encompasses everything from early detection and intervention, including newborn screening, genetic testing, genetic counseling, just getting that diagnosis as quickly as possible, and then ensuring that once a diagnosis is made, that patients have access to affordable quality healthcare and coverage, and that they can get the treatment that they need to address their condition. The second pillar is accelerating therapeutic development. This one is pretty self-explanatory. It's everything to do with our work with FDA, our work with the researchers who are developing new therapies to ensure that those therapies are safe, effective, and get to market as quickly as possible. We are lucky to have really great relationship with regulatory bodies who do consider the different drugs that are being developed, and we work really hard to maintain that relationship on behalf of the patients. And the third pillar is empowerment and independence. And this is really everything related to things that ensure that people living with disabilities are able to be employed, to travel, to live life just like anybody else. As you all know, the ADA passed 30 years ago. July is the 30th anniversary, but it doesn't cover, a whole lot of things, including air travel. And so air travel is a really big priority for us because it is something that unites almost everybody under the MDA umbrella. Is access to air travel is critical, especially for people with a rare disease like Pompe who might be traveling across the country to participate in a trial or to get a treatment that's not available in their hometown. And so access to air travel is something that's both important for obviously things like work and personal travel, but also for access to health care. This slide is in no way representative of everything that we do, but it's a pretty good sampling of the kind of things that we focus on. I'm going to hit the next slide. So we're going to run through briefly. So as I said, the first one really encompasses everything around early detection, intervention, and care. You can go to the next slide. And then therapeutic development, as you all can see, expanding involvement in therapy development and review, and our relationships with the FDA. Empowerment and independence, improving air travel. And we are also working on a new bill this year that's sponsored by Senator Casey from Pennsylvania, which would incentivize employment for people living with disabilities. It creates tax credits both for hiring people with disabilities, but also allows employers to take advantage of things like grants to make their workplaces more accessible. And so we are pretty excited about that and are excited to endorse that legislation this year. Next slide. Okay, so how have our priorities reacted to COVID-19? As you all know, the reason that we're doing this event the way that we're doing it right now is because of the current pandemic. And so while our priorities have not changed and as a response to COVID-19, we are, ensuring that the way that we react to them is in line kind of with what we laid out for our priorities at the beginning of this year. So under access to care and therapies from day one, in addition to everything that we're doing already, we're also working to promote policies that ensure availability of testing and treatment to the neuromuscular community without discrimination. We have heard told, in the past, in certain states or maybe hospital systems, there are systems of triage that determine, how somebody may or may not be determined to receive care in the event of a pandemic, when things like ventilators might be, in short supply. And so we want to ensure that, if that is the case in certain areas, that these triage policies do not unfairly discriminate against people living with pre-existing conditions, including neuromuscular disease. And so we're working both with the administration and with members of Congress to ensure that those policies are non-discriminatory. Under accelerating therapeutic development, we are advocating for continued development of therapies throughout the pandemic. And we're also advocating for innovative clinical trial design structure to ensure that trials that started before the pandemic can continue to run, even maybe with an amended schedule or amended access, or somehow to ensure that people who are enrolled in these trials can continue to do so, and that the trial is not delayed as a result of the pandemic. And so we have been working closely with the FDA to ensure that they know that the neuromuscular community is supportive of that. And under empowerment and independence, we're promoting policies that enable everybody to access necessary funds and services. So those are things like the stimulus payments that go to individuals who, across the country, but also paid leave for people who might need to stay home to care for a family member who is at increased risk of COVID-19, or who might be unduly affected by COVID-19. So somebody living with a neuromuscular disease is at a higher risk of complications, and it would, be important that their caretaker, their family member would be able to take care of them in the event of that. And so we want to be sure that they have the time off that they need to do so, and are able to still survive financially. We can hit our next slide. All right, at this time, I'm going to turn it over to Mark Fisher. Mark is our Advocacy Engagement Manager. He is the specialist when it comes to working with all of our really, really amazing advocates like you guys. So please do feel free to enter any questions into the chat box throughout our conversation, and I will turn it over to Mark now. Thank you.
Great. Hi, everybody. My name is Mark Fisher. I'm an MDA Advocacy Engagement Manager, and I am thrilled to be here with all of you. I'm glad that we were able to reschedule this and able to put on an event like this. So we're happy to have you, and thanks for coming. Just two things you see on the screen is two advocacy resources that I will repeat again at the end, but if you want to bookmark them, it's mda.org/advocacy, or for folks who like to use Twitter, please follow us at our Twitter handle there. It's MDA_advocacy. So I'll talk about that again, but on that site you can see a lot of what Brittany talked about, a lot of things about newborn screening that might be of interest to everyone on this call, and then on Twitter it's breaking news of everything we're doing. So I'll plug it again, but I wanted to start the presentation with that. Great. So I wanted to talk a little bit about what we're going to answer today. So here's some quick questions that I hope at the end we can answer. Brittany set me up perfectly for most of these. But what is advocacy, and what does that look like at MDA? Brittany gave us a great head start there. What are some of the issues we work on? Brittany mentioned quite a few. I'll talk about a few more. And then why do we even do this? Why do we even lead on advocacy efforts? What is grassroots advocacy and how you can help? So those are some questions I hope that we can answer. So we want to go to the next slide. I wanted to talk a little bit about why we even do this. I think sometimes for many folks, they might be surprised that an organization like us even gets involved in the legislative process or a political process. Like sometimes it can be a little sticky for folks, or they might just wonder why we even get involved. And the quick answer is we have to. We don't have a choice, and we want to, because we're here to transform the lives of people affected by neuromuscular disease. We can't do that if we don't advocate for public policy to help us. We can't do that if we do not get involved in the legislative process. So, for example, we can't truly transform the lives of people affected by neuromuscular disease if every newborn is not screened for some of our conditions, including Pompe. We can't transform the lives of people affected by neuromuscular disease if our community doesn't have access to health care, if we're not increasing funding for medical research, or if we're not making sure that therapies are being developed quickly but effectively. So we can't accomplish our mission unless we do get involved in advocacy efforts. So that's why we do it. So on the next slide, what is grassroots advocacy? So that's what I specialize in. That's what I'm excited about. Grassroots advocacy is everyone on this call right now. It's everyday people who contact their lawmakers, who share their stories, who organize in their community, all coming together for change. It's not necessarily the high-powered, it's not the mega donors, it's not that, it's everyday people who just want their voice heard, who are demanding change in their country and their community. That's what grassroots is, and it's extremely powerful. As you can see on the screen there, this is just one example of grassroots advocacy. We had over 90 volunteers come into DC in the fall and meet with their members of Congress. They told their stories to their members of Congress and asked them to act on urgent legislative issues. That's grassroots advocacy. It's constituents coming together to raise their voice for change in their community and in their country. And that's what I hope everyone on this call will eventually want to do and want to join us in. So on the next slide, I'll talk a little bit about what is the role of the grassroots volunteer. And the good news is there's a role for everybody. We have a lot of things that everyone can do to help us achieve our mission. First, the easiest thing to do is to sign up for our list, and I'll show you how to do that at the end. But when you sign up for our list, you'll receive timely email updates about what's going on in DC or in your community and how you can help us. That is the first step, is just signing up with us and getting on our list, and that is super helpful if you could do that. Once you do that, we will then make sure you know what's going on important issues and how you can help. And you can do that. We do that by receiving some timely email updates from us that we might ask you then in turn to email your member of Congress or email head of an agency or another sort of decision maker. You can see an example of that on the right side of the slide, where we ask people to email the Department of Transportation and help us with an issue. So in addition to emailing or contacting your legislators, which is really important, we also want to make sure that our advocates have their voice heard by government agencies. It's very common to think that Congress decides everything and they make all the policy, but government agencies have a huge role to play, and their decisions can affect everyone in the country, and we need to make sure that our voice is heard. So that's why we ask our advocates to also contact agencies, such as the Department of Transportation, which you see on your screen. Might be the FDA, might be Health and Human Services. It could be a few things. So we just want to make sure that the government agencies also hear from us. The next thing you can help us with online is sharing your story. This is probably the most important thing a grassroots advocate can do, is share your story. It really cuts through the noise, which I'll talk about in a second. I can go to the Hill every day, Brittany can go to the Hill every day, but it's really those stories of people who have one of our conditions that really cut through the noise, or a caregiver that can really, really sway a lawmaker. So your story is so powerful. And I'll show examples of that, how we've used stories in the past to really cut through the noise. But that's the number one thing an advocate can do. And the good news is you're an expert. You're an expert on your story. You don't necessarily have to be an expert on policy. You can be an expert on your own story, and that's super powerful. We also do lots of things offline. Now, it's kind of odd to talk about this right now with the COVID era, but we do have, hopefully we'll go back to a time we can have members of our advocacy network meet with members of Congress in their offices. Again, I showed you a picture on the slide before about when we did that, when we brought people into DC. We hope we'll get back to that time. I think we will soon. But if that's not the case, we can have people call members of Congress, pick up the phone and call them. That's also very powerful. Our advocates also write blogs and other pieces for us. We just posted a piece on our Strongly blog written by someone in the ALS community about how ALS affected him during COVID. So we have a few examples of people writing a blog for us. And then they can obviously organize in their community. Now, no matter what option you choose, we will make sure that you're prepared. So if you're emailing a member of Congress, or if you're making a phone call, or you're going to go visit a lawmaker, we'll make sure you're prepared with a talking points, a sample letter, maybe a sample phone script. If you're volunteering your time, the least we can do is make sure that you have everything you need to be prepared, and we will do that for you, no doubt. So on the next slide, I want to give two examples of how your story can be very powerful for us. So the first one on the left is, his name is Josh. He actually was an intern for us this year, and he went and joined a bunch of other advocates in the rare disease community, and they went to Capitol Hill and urged their lawmakers to support a lot of few bills. One is including the newborn screening program, which I know has been brought up a few times today. So he was able to meet his lawmaker, tell his story, and I have to imagine from the smiles in that photo that his lawmaker is going to remember him. And that is an example of how your story can really cut through the noise, as the lawmakers will remember volunteers. On the right side, well, this is an example of a blog. So we had a gentleman, his name is Chris. He came to our Public Policy and Advocacy Conference in the fall, and he met with his members of Congress, just like Josh did. And not only did that, he was able to write a blog for us about his experience. So there are just a lot of opportunities where your story can really help us and really help us with some of our legislative efforts. On the next screen, if we ask you to raise your voice or we ask you to contact your member of Congress, we will only do that if we know it's going to make a difference, or we know it's an important thing to do. And I wanted to highlight some cool successes we've had with our grassroots volunteers to show that what you would do is really powerful and will make a difference. So the first is actually happening tomorrow. It's a patient-focused drug development meeting. This is a great example of how the government agencies can hear our voice. It's not always lawmakers. So tomorrow we're going to have a slew of folks from the Pompe community tell their stories about how this disease has affected them or their loved ones. And FDA will be watching. FDA will hear them, and hopefully that will sway them to get some of these treatments out quicker, or get some, hopefully a cure one day. So we're making sure that the FDA hears from our volunteers. That's happening tomorrow. Hope some of you are signed up to go to it and watch it virtually. Also, the Policy and Advocacy Conference, which I just spoke about, that's where we brought 90 volunteers in, and they're able to meet their members of Congress that day, which is really exciting. Newborn screening program, I'll talk about this in a second. I know you've heard this a few times as well, but this year, even though the newborn screening program unfortunately is not reauthorized right now, we're hoping to get that done through the Senate this year. It's still happening. It's still working, which is great. And actually in the spring, the Secretary of Health and Human Services restarted a key committee on the newborn screening program, which that might sound a little in the weeds, a little wonky, but it's crucial to make sure that the program functions even though it's not reauthorized. And we did that because over 1,100 advocates raised their voice and demanded that the Secretary restart a key advisory committee. And you can see a little graphic on there. So that was a great win. We've made progress on accessible air travel. We've had members of our advocacy community write into the Department of Transportation, urging them to make lavatories more accessible on single-aisle aircraft, which is a good thing. So again, we're making sure that the agencies hear from us. This year, we had another increase in research funding at the National Institute of Health. Now, I think this is, I might be wrong, but we've had multiple years of increases. I think at least 5 years we've had increases to the budget at the National Institute of Health, which is our nation's #1 research institute, and that's crucial. We need to be making sure we're investing in medical research to find cures and therapies and treatments for our conditions. So that's a huge win. That's a direct result of advocates raising their voice and demanding that we continue to fund medical research. And finally, we've had a victory on COVID-19 emergency legislation. There was the Family First Coronavirus Act that passed, and that increased funding for testing, increased support for Medicaid, and a few other things as well that we had advocates raise their voice on. So that's a lot, but that's a good thing because we are really making a difference, and it's because of our grassroots advocates. On the next slide, I'm going to show the map that I think you've seen quite a few times today, which is the newborn screening program. I wanted to show this for 2 reasons. One, if I would have showed you this map a year ago, well, heck, if I showed you this map 2 weeks ago, it would be a lot less colorful. We have seen lots of states add SMA to their screening program, add Pompe to their screening program, add both to their screening programs, and this map is really filled in the last few months, which is very exciting. So I wanted to share that to let you know that we are making progress. But sometimes advocacy has to be done state by state. Yeah, I think sometimes it's a myth that the federal government can accomplish everything, and it's not always true. Sometimes it has to happen state by state, and the newborn screening program is an example of that. That sometimes that state and local advocacy is just as important. And then on the last slide that's up on the screen, again, we hope you'll join us after all this. We need you. We need your voices. We need you to help us out. So please join us and become a grassroots advocate, you can do that at mda.org/advocacy. Hit become an advocate and then fill out the information. It's that simple. You'll be on our email list. You'll make sure that you get all the updates you need. Give us a follow on Twitter. That I update that I update it every day, multiple times a day. So you'll see the latest that's going on. So with that, I think we'll take any questions that you have, and we're really happy to be here. Thanks for letting us come today.
Hey, Mark, thank you. Thank you very much, Brittany, for your presentation. I know you mentioned this, Mark, in your talk for in the very beginning, but we did get one question. Does the MDA offer any patient advocacy training? Not just examples of what we should do, but is there any training program that anyone could volunteer to take?
Yeah, I can speak about, I think when we talk about patient advocacy, I'm not sure if the question meant to maybe patient advocacy in terms of maybe a loved one's in the hospital, a loved one's seeing a doctor, and we need insurance to help us, or the hospital that help us, that sort of patient advocacy. I don't know if I can speak to that, but I can speak to training to developing grassroots advocacy skills. We do offer that. We have something called the MDA Advocacy Institute, and every month we have a new webinar that we that focuses on a different topic, where we train advocates on what's going on and how they can help. We've done one kind of on something similar to what we saw today, kind of a 101, but what we're doing with advocacy, how you can help. But we also did one with the FDA where they talked about how they're adapting to COVID-19 and how that's affecting clinical trials and that sort of thing. And then we're going to do one. This might be this is a little bit breaking news, but we're going to do one at the end of this month where we're going to be celebrating the 30th anniversary of the Americans with Disabilities Act. Not only celebrate, but we're going to show what still needs to be done and how advocates can help us do that. And I see Brittany popped on, and it can help with that question too.
Yeah, thank you, Mark. The only thing I wanted to say about the Advocacy Institute is that all of those sessions have been recorded, the ones that we have done so far. And so if you want to go back and take a look at what we've discussed so far, the first one was kind of a basic overview of what is advocacy, how do you get involved. The second one, as Mark said, focuses on, really on, we had a number of speakers from the FDA who told us about and answered a lot of questions about how the FDA is reacting to the COVID-19 pandemic. And as Mark said, the next one will be on the 30th anniversary of the ADA. We only just launched this series in the last few months, which is why there's only a few of them for now, but we're really excited about it, and we hope that you guys will join it and take a look at the ones that we have already done.
Great. Okay. All right. Well, I think that is it, and we pretty much are right at our time to end. So I appreciate your time today. Thank you, Mark. Thank you, Brittany, very much. Have a great rest of your day.
Thank you.
Well, that concludes our Pompe Symposium for today. I want to thank all of you and all of our presenters for their time and effort that they spent on putting together their presentations. I also would like, again, to thank Dr. Heather Lau for serving as event chair. Also, thank our symposium supporters, Sanofi Genzyme, Amicus Therapeutics, Spark Therapeutics, AvroBIO, and Diplomat Specialty Infusion Group. And thank you to you for taking time to join us today. We hope that you found it informative and helpful. If you have any questions after the symposium or about other Engage programs, please visit mda.org/engage, or you can email at mdaengage@mdausa.org. We hope to see participants at tomorrow's Pompe Disease Patient-Focused Drug Development meeting. It will be running from noon Eastern to 5 p.m. And the page for the link will be sent in the chat session in just 1 second. And then finally, I want to remind everyone that we will be emailing a brief survey of what you thought of the Pompe Symposium. And we really, really do want your honest and personal feedback. We'll also be sharing additional educational resources provided by some of our supporters today. So be on the lookout for an email from MDA Engage on those extra information pieces. So thank you all again for joining, and we look forward to you joining other Engage events in the future. Have a good rest of your day. Bye-bye.